I would like to invite our third speaker, Dr. Rizwan Rafiq, for presenting the presentation of frequency of anxiety and depression among patients with chronic spontaneous urticaria. He is working at a Balika hospital as an assistant professor of dermatology. Dr. Rizwan, please.
Hospital, which is affiliated with Hamdard University. I'm also working as a consultant dermatologist at Aachen University Hospital and Ziauddin University Hospital. My today's topic of presentation is frequency of anxiety and depression among the patient of chronic spontaneous urticaria. The scheme of my presentation for the next 10 minutes will be, we will discuss the introduction, So, the urticaria. Urticaria is defined as transient respiratory or without injury and usually persists for less than 24 hours. Urticaria is not a single disease entity. It is basically a cutaneous fluid infection that basically starts from the related to the effect of leads to the degeneration, results in acceleration of the plasma into the lungs and the formation of characteristic eyes. These eyes are regulated immunity failure and plaque. Urticaria broadly divided into two categories: acute urticaria and chronic urticaria with the cutoff 6 days. Chronic urticaria, which is divided from divided into three main primary groups, which are physical urticaria or inducible urticaria, secondary urticaria, second underlying medical condition, and third category chronic spontaneous urticaria. Physical urticaria is the main are the dermographical blood pressure urticaria, chronic urticaria, cold urticaria, solar urticaria, cold urticaria. Second category is urticaria, second category underlying medical condition. So after the definition of physical etiology, what can support what makes you uncover an occult cause of underlying occult medical cause for urticaria? Why? Detailed history, thorough examination and investigation. It includes both some baseline screen and some targeted investigations aimed for the scenario. Physical urticaria constitutes 20% of the chronic urticaria, while the urticaria secondary to underlying medical condition constitutes only 1 to 2% of the chronic urticaria cases. Majority of the cases are secondary to chronic spontaneous urticaria. So, chronic spontaneous urticaria means defined as spontaneous development, means there is no physical stimuli and no underlying medical condition. Spontaneous problem which is with or without angioedema that during the emergency sleep duration. CSU, chronic spontaneous urticaria, again divided into two categories: chronic idiopathic urticaria, chronic autoimmune urticaria, because it is considered that 40 to 45% of cases of chronic spontaneous urticaria there is an underlying autoimmune disorder. So the prevalence of urticaria has reported in many studies are between 0.5 to 1%, while the lifetime prevalence is around 15 to 20% and peak incidence is seen between the 20 to 40 years of age group. Introduction. The depression and anxiety are the most common psychotic disorder present in the patients of chronic spontaneous urticaria. The prevalence of depression and anxiety in patients with CSU ranges from 13.5 to 80% and 7 to 30% respectively. The overall incidence of anxiety and depression disorder among the general population of Pakistan is 33.6%. Anxiety, depression of chronic urticaria, is by the quality of life, Data was taken after receiving approval. The patient with known psychiatric disorder are taking any psychiatric medicine were excluded from the study, and data analysis was done by the program SPSS version 19. Study tool. The anxiety and depression is assessed by AKU-ADS. Comprises of 25 questions, in which 13 questions are psychological and 12 somatic. It is a validated tool. This is important. It is validated, is translated in Urdu, and many studies are done in our population with the help of this AKU-ADS. Total score can ranges from 0 to 75. Patient scoring 19 or above what level is suffering from anxiety and depression. AKU-ADS is differential scale. It rank and assess the severity index by using 4-point scale. Means if the patient says all the time, most of the time, sometime, not present at all. We can categorize these symptoms by all the time means 7 days in a week. Most of the time means 2 to 5 days in a week. Sometimes 2 days or less than 2 days in a week and not present at all. So by this, we reduce the chance of inter-rater bias, and also it improves and make the inter-rater reliability comparatively more easy. So operational definition are again it's spontaneous development of transient itchy eruption with or without angioedema that lasts for more than 6 weeks of duration. Again, the cutoff to label the anxiety depression is 19 or more than 19 score of AKU-ADS. So this is the result. The figure 1 shows the 26.7% patient suffer from the anxiety and depression. Figure 2 shows the mostly involved age group is in between 26 to 50 years. Figure 3 shows the chronicity of the disease is directly related to the chance of development of anxiety and depression among the patient of chronic urticaria. As you can see, around 90% of the patient belongs to the disease group who is suffering the chronic spontaneous urticaria more than 6 months of duration. The table 1 again shows the most commonly age group is in between 26 to 50 years. There's a male preponderance. 57.5% are males, married person again involved more, and education status, the mostly affected person belongs to the education status of intermediate or above. Occupation wise, mostly patient belongs to they employed in a private job, and the history of angioedema present in 4% of patients, that is 2.7%. So the chronic spontaneous urticaria is one of the most disabling condition, but its effect on patient quality of life is often underestimated, with few reports in literature in local context. Combined frequency of depression and anxiety in our study were slightly higher than the estimates reported previously, that is 24%. In our case, it's 26.7%. Literature has been reporting high prevalence of mental disorder like anxiety and depression among the general population. However, this reported prevalence again vary widely. That is again due to the difference in study population and their assessment methods. We therefore intended to evaluate the prevalence of depression and anxiety among the CSU by using AKU-ADS. Study limitation, single center study, small sample size, it is a cross-sectional study, so we can't calculate the temporality of the condition between the exposure and the outcome. Exposure is the chronic spontaneous urticaria and outcome is anxiety depression. It is conducted in dermatology clinic of a private tertiary care hospital, which is relatively expensive, so it's not a true indicator of the general population, confined to those patients who are suffering from the chronic spontaneous urticaria. The other types of urticaria were not included in the study, and AKU-ADS could not able to distinguish between anxiety and depression. Recommendation: depression and anxiety in CSU patient has a negative impact on quality of life, and it can lead to poor compliance with treatment, which results in worsening of situation. Early detection of anxiety and depression may help to improve the treatment outcome. So the prevention strategies need to be designed and implemented for the high-risk patients suffering from CSU. These are the references, and thank you very much.
Thank you so much, Dr. Rizwan.